Hello, I'm Dr. Dayal Mirchandani. I'm doing this webcast for Sify.com.
Doctor, why have we witnessed a rise in psychological disorders and illnesses from past few years?
Life is becoming a little more complex. People are very much more competitive because they want to get ahead. There's much more competition. People expect much more from life than ever before. And because of consumerism, people want more and more things and feel deprived if they don't have those things. And on top of that, there are things like television and internet for which make people stay awake for long hours and not sleep enough. These are some of the factors that have changed. Plus, we also find that parents have less time for their children because both parents are often working, or many parents after they come back from work are watching television rather than spending time playing with their children or interacting with their children.
How do the mind-body therapy techniques help in healing psychological, psychiatric and psychosomatic disorders?
First, I'd like to tell you that psychological disorders can be helped in a number of ways. Sometimes it's medicine, sometimes it's mind-body healing techniques, but medicines normally help control symptoms rather than cure something, while mind-body healing techniques help change the way one thinks or create psychological change that is permanent in nature. So it often helps cure a whole lot of physical things which otherwise, psychosomatic illnesses, which otherwise are only controlled by medicines. Things like some cases of blood pressure, some cases of asthma, some cases of chronic pain can be helped by various psychological techniques, imagery, hypnosis, and there's a whole lot of psychological techniques to help people with these kind of disorders. Mind-body healing also helps with other psychological disorders like anxiety and depression and some of the phobias and those kind of disorders also.
Please share your valuable thoughts on the behavioral treatments of the following. Anxiety.
Okay, anxiety disorders. There are a number of behavioral techniques for helping people with anxiety disorders. Cognitive therapy is one that there's been a lot of research to show that it is, you help a person change the way they think and they're no longer anxious. Behavioral techniques such as exposures, you have the person go into places which earlier made him anxious till he no longer feels anxious and learns new habits. Then there are other techniques like hypnosis, there are meditative techniques which have been incorporated into psychological techniques to help like mindfulness, which help make people deal with situations or thoughts that earlier would make them anxious.
Obsessive-Compulsive Disorder or
Obsessive-Compulsive Disorder is one of the more disabling kind of disorder which makes you feel that everything is wrong and you have doubts about whether things are right, whether you're being contaminated, whether the world seems much more dangerous. So it really makes people feel really terrible. And medicines help control the obsessions and the compulsions, like to wash your hands or something. But behavioral techniques are the ones that really help people change the way they think, so they no longer think these kind of. Brain lock is one method developed by Dr. Jeffrey Schwartz. There are cognitive therapy techniques like exposure and response prevention that help people get over these disorders permanently. So behavioral techniques have really transformed the way that these disorders are now handled.
Depression.
For depression, there are a whole lot of techniques that help people. Cognitive therapy is the most commonly used one, but also something known as interpersonal therapy, where people learn how to relate better to other people, how to think differently. Hypnosis is another one. So there are a number of techniques that help people get over depression and learn how not to think in a way that gets them depressed.